to specifically say thank you to Dr. Amanda Kornowski, who made this particular project possible. I think I saw her joining, or she might still here be with us as a virtual participant. With that, I will turn things over to our next presenters.
Hello, everyone. My name is Lydia Nguyen. I'm a second-year student pharmacist.
And my name is Atreya Ghosh. I'm a first-year student pharmacist.
And we partnered with the Pitt Pharmacy Innovation Lab and the Pittsburgh Poison Center to do a special research topic on Pittsburgh Poison Center modernization. So I got involved in this project because I'm actually an intern at the Pittsburgh Poison Center. So Atreya and I partnered with Dr. Patel and Managing Director of the Poison Center, Dr. Amanda Kornowski, to create a project with the goal of creating a compelling argument as to why the Pittsburgh Poison Center needs to modernize its infrastructure as they do receive only state and grant funding. So a little bit of background about what the Pittsburgh Poison Center is. I bet a lot of you recognize Mr. Yuck here. But the Pittsburgh Poison Center is a free phone hotline service to the public, staffed by expert nurses, pharmacists, physicians, and it's available 24/7 to answer questions about potentially poisonous exposures and general toxicology questions. And while the Pittsburgh Poison Center only currently offers a phone hotline, in recent times, other poison centers across the country have started implementing other alternative communication methods to interact with their communities, including text and SMS and web-based services. So in the beginning of the semester, in regard to our project, a lot of our work included looking at past literature from other poison centers across the country as well as around the world that discuss alternative communication methods and their potential efficacy. So from our literature search, we were able to see that 6 poison centers in the United States currently offer alternative communication methods aside from the phone hotline. And in a study comparing poison center, phone, and chat follow-ups, they found that chat-based systems allowed for a greater efficiency. And while looking at literature regarding health information-seeking behavior, we were able to see that patients with unintentional injuries or exposures to medications had a stronger preference toward chat-based systems over phone, in part to the perceived privacy. So after doing this background research, we came out with the project objectives of determining if the Pittsburgh Poison Center would be able to reach more people if it offered these alternative communication methods, therefore justifying the need to modernize and get that funding, and if any, determine what alternative communication methods would best serve the Pittsburgh Poison Center.
Yeah, so the Pittsburgh Poison Center actually, for every phone call they get, they collect a lot of relevant caller information. Just a few of the things they collect that were relevant to our project were the age of who's being called about, the time at which someone was calling, the type of toxicological exposure that they were calling about, and who's calling, such as if an individual is calling or if a healthcare facility is calling in regards to an individual. So at the beginning of the semester, we were given access to a little bit of this data where we saw some differences in caller behavior based on the age of who is being called about. So an example of what we saw was that young adults were seen to call during the earlier hours in the morning, like between midnight and 6 a.m. Compared to other times of the day, and they were also more likely to call about unintentional exposures. So based on our analysis of this data, as well as the literature reviews we conducted at the beginning of the semester, we justified the need to research more into modernizing the Pittsburgh Poison Center, and this helped us to formulate our study goals. So we decided that we wanted to distribute a survey to Pittsburgh and Western PA to see how they communicated with their healthcare providers and how we can apply that to the Pittsburgh Poison Center. So we created a 13-question survey which collected basic demographic information such as age and the county of residence, because that was relevant because we were looking at how Western PA in particular interacted with the Poison Center. And then we also collected information on current patient information-seeking behaviors, as well as patient communication preferences, and then patient communication preferences specifically for the Pittsburgh Poison Center. So this will tell us a little bit about how younger residents of Pittsburgh and Western PA prefer to interact with healthcare services in general, and then how they would prefer to interact with the Pittsburgh Poison Center, such as through a chat-based system, a video system, or if they prefer a phone call. In addition to those information, we also collected information about At what severity of an exposure would someone be willing to call or contact the Poison Center, and how the communication method would impact the severity at which they would contact the Poison Center. So future steps that we would like to do for our survey is we've currently formulated it. So we would want to apply for IRB approval and then ultimately distribute the survey. And then hopefully in fall, we would want to analyze the results we get and determine if there is any need to modernize the Pittsburgh Poison Center, as well as what communication method we would choose to utilize. Thank you. Thank you to Dr. Patel and Dr. Kornarski for all your support in this project. And if anyone has any questions, we'd be happy to answer.
So if you want to grab a quick snap of the QR code to offer your feedback, roses, thorns, and buds, also open for anyone who might have a question. John.
So nice work. Just a question with regard to the other 6 centers that you felt had used perhaps prevailing tool sets. Is there a unique structure to those 6? I know that the Pittsburgh Poison Center is affiliated with UPMC in some capacity. I'm not sure exactly what the structure is, but in a lot of organizations, making changes can be complicated just by virtue of the organization which either controls or manages them. After you gather your data and you go to present it, do you think that the structure of the Pittsburgh Poison Center, the reporting structure, creates any unique challenges for the implementation of your modernization plan?
Yeah, definitely.
And a quick reply of a quick reiteration for folks joining by Zoom, the question of implementation and how does the structure of an organization present potential barriers or opportunities as you're thinking about the data you're collecting?
Yeah, so we were not able to get into the nitty-gritty of what the other poison centers currently have in practice. Like you said, the Pittsburgh Poison Center is currently affiliated with UPMC Toxicology Service and the Emergency Department. So with Dr. Kornarski as our stakeholder here, informing us on how to go about the project and how our data would potentially help her in the future, and my firsthand experience working at the Poison Center, I can definitely see it would take a lot of work to completely, revamp any sort of structure. I know in terms of staff, how we chart information, that would any sort of change in our communication method would definitely change our workflow completely. But I think that's something that would take a long-term investment over the course of, a long time. But it would definitely create, that future benefit if it would provide, better accessibility to the Poison Center services. So while there are definitely anticipated challenges with, revamping a sort of archaic structure that the Poison Center has had for the past many decades, modernization, and especially these times, I feel like is definitely necessary to research into and valuable to the Poison Center's future.
Thank you again.